My name is Birte Dinesen. I'm a researcher here at the Department of Health Science and Technology. I'm an associate assistant professor. I'm working with Telehomecare research, and that means bringing technology from the patient's home, data from the patient's home to the healthcare professionals. That can be at the hospital, it can be the district nurses to their electronic patient's record. The TELEKAT project is about COPD patients, patients with chronic obstructive pulmonary disease. We have about 300,000 patients with that disease in Denmark. They are a very big group, and 20% of them are going to the hospitals, and they have a very high readmission rate. And within the first month after they've been discharged from the hospital, 24% of them are readmitted again. So it both means a lot for them, quality of life, but it's also very expensive with economically wise. So what we want to do is to learn these patients to take care of themselves by using this technology, and to empower the patients so that we can avoid that they are being readmitted all the time. And we want to find out what patients is this relevant for, because a chronic COPD patient is not just one. We want to find out what patients will this be good to use this kind of technology for, and how long time. So our patients is going to have Telehomecare technology in their homes for 4 months. And during the 4 months, a district nurse will come and visit the patient, and the patient will monitor themselves. They will have to monitor their blood pressure, a weight, a pulse, saturation. That means how much oxygen do they have in their blood. And we are also able to measure their lung function by their blowing in a spirometry. And these data are sent to the district to the record at the district nurses, but also the staff from the hospital and the GP, general practitioners, and the healthcare center are able to see the data. We are also making an electronic platform so that the patients will be able to see their own data. What we want to try out is, when they're seeing their own data, will this encourage them in order to take better care of themselves, and they will be able to help themselves better. If they know now I can walk a bit more if I do my own exercises every day or whatever. We see from the university that there's a lot of synergy when we're working very closely with the clinical staff from Aalborg Hospital, the municipality of Aalborg, or Hjørring, or the GPs and the healthcare center, because they bring us their problems that they are having in their everyday life when they're working with these chronic patients, and they can put words on what are the issues from us as clinical staff, what do they experience, are the problems seen from the patients. And as researchers, this is very important for us when we're developing and testing and bringing out all this technology, that we have this very close interaction and process together, developing and trying to get it out to work so that it fulfills the requirement from all users of this. Technology play, of course, an important part, but the main issue is bringing the clinical partners to work together by using the technology, but the technology does not have to be in focus. It has to be a tool for helping them in the collaboration with the patient and between each other. When we are working in the patient's home, of course we want to be very aware of and respect the patient's private life. So bringing technology into the patient's home and making it useful for the patients, the relative, and the healthcare professionals are some of the challenges. But then, of course, when we have to look at it, this is when it's being implemented. But in order to have it implemented in a larger scale afterwards, there are still some issues on who is paying for it, administrative, the responsibility. So we are in very close collaboration also with healthcare authorities and researchers within healthcare economy to be able to take up these challenges and hopefully be able to bring it to the politicians so they can solve it for a larger enrollment. Telehomecare is a very new discipline in Denmark. Nationally wise, we've just got a 3 years program for doing home monitoring in Denmark for chronic patients, diabetes, heart and lung patients. So we are ahead and we are in front also internationally wise with our project, because we try and go across sectors with many partners at one time, and at the same time work with the patient being a partner in a team and not being a passive partner. It's very important that we collaborate across firms, university and clinical partners in the region of North Jutland, because it's like a chain. We need each other and we need the synergy. You can't develop technology for the healthcare sector without involving the healthcare professionals. And working with a user-driven aspect is also brings lots of energy. So it gives us a very good competence as a region to be a test bed for new technologies, and hopefully for bringing firms to this region that they would like to have these competences and that we are able to work very interdisciplinary. I think that's a very good and strong position we got, that we can work so interdisciplinary as we do, and also with the clinical staff.